Hi everyone, my name is Dr. Christiane Schweitzer with thesittingsociety.org, where you can learn how to live a healthy and pain-free sitting life. In today's video, I want to talk about a problem that can be misdiagnosed to help prevent you from any unnecessary pain or surgery. After I explain what it is and how it can happen to people who sit all day, I'll give you a couple stretches to help you out. The problem I'm highlighting in this video today is a tight or contracted posterior shoulder capsule, which often prevents someone from lifting their arm up past their shoulder height. Another problem with the same presentation is a frozen shoulder or adhesive capsulitis. So if you're having this problem, you want to make sure your doctor does the appropriate tests to differentiate between the two. If you want to see a couple of the tests that I use to get the correct diagnosis, just let me know in the comment section down below. I'd be more than happy to make a video about it. The posterior capsule is the thinnest part of the shoulder capsule, located in the back of the shoulder from the glenoid rim to the humeral head. The function of the posterior capsule is to prevent the humeral head from translating or moving back when the arm is flexed, adducted, and internally rotated. That's why you see this in a lot of overhead players. The cause of this contracture in throwing athletes is said to be from repetitive tensile forces on the deceleration phase. So that's like right at the end of the throw, right? But it can also happen to non-throwers, and that's who I'm talking to. Okay, let me give you an example. I had a patient come to me. He wanted a second opinion because he just got diagnosed with frozen shoulder from an orthopedic surgeon. He presented the same as a frozen shoulder. He couldn't lift his arm up past shoulder height. And I did the appropriate tests and ruled out frozen shoulder. He actually did have a tight posterior capsule. This was a different diagnosis than frozen shoulder, so it needed a different treatment protocol. Okay, so how is it that non-throwers get the same condition that someone that is doing overhead throwing frequently gets? What people who sit do is often their desk is too high, so they have to flex. They have their keyboard way too far, so they're almost reaching for it. And when you type, you usually are in the adducted mode or close to the midline of the body. And our hands, which are normally or should normally be to the side, they're internally rotated. So we do a lot of the same things that athletes do, just kind of, less aggressive per se. But some people, like my client, he answers phones a lot. So he's doing a lot of reaching and grabbing, typing, grabbing, reaching, things like that. That could be how that happened to him. It wasn't from an injury and he wasn't an athlete. Okay, the first stretch is the seated posterior capsule stretch. All you do is bring your arm out in front of you, or your hand out, and you bring your arm across your chest. You don't have to internally rotate it. Take the other hand, place it slightly above the elbow, and then you want to bring the outstretched arm towards your body. And you can also rest your hand right here on the opposite shoulder. And then you just want to bring it until you feel a little stretch, and you should feel it right back here. And just bring that towards you and hold it. You don't have to keep pressing it really hard. Just bring it towards you till you feel that this is stretching back here. Stop, and then just hold it for about 10 seconds. And then you want to relax and do the next side. Bring it across your chest. Take the other hand, pull it towards you, and I like to rest my hand on my shoulder. And then you might feel a little, something like that, or you might go like that. If you feel an ow, 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 please stop. Don't do it anymore. And then you just hold that for about 10 seconds. Now when you go to the other side, you might feel it's a lot easier. So now you can bring your arm a little closer towards your body, and then just hold it there at the end of the stretch and breathe and hold for another 10 seconds. And then you want to do the same thing one more time on the other side. So it's 10 seconds each side, and you want to do it 2 times on each side. All right, let me show you something you can do when you're done in your workspace, when you're at home, or if you want to do it on the floor in your workspace. Up to you. Lay down on the floor, bring your arm out 90 degrees. You want to bend your elbow and then just push down on your forearm just as far as it'll go to end range. And then push against that forearm while pushing back with the forearm against your hand. And hold that for about 10 seconds. Take a nice deep breath, and then you're going to release that as far as it'll go down to the floor and rest there for a moment, and then push it back against that hand for another 10 seconds. Take a nice deep breath, and then at the end of the 10 seconds, you're going to release your arm down. Notice it's a little bit further down towards the floor, and you should feel it right around there. And then go to the other side.